I'm going to now invite Royston Flood to come up and introduce a message from Dr. David Nabarro from the United Nations, who has a video presentation for us.
I've known David Nabarro for some time. As you know, he was the special representative of the Secretary General of the United Nations, focusing on pandemics, trying to bring together all the disparate bodies within the United Nations and other aid agencies. He's a very special man who has a passion for humankind. He's now finished his role with regard to pandemics and is now focusing really on food availability. But I think in this very short presentation, you get a sense of his contribution to the field, his very clear common sense approach, and is very much his understanding that it's the human dimension that will be critical in defining how we survive, how we deal with this problem, how we tackle it, and how we bring it onto the public agenda. Thank you.
Hello and good day to you. I'm delighted that I am taking part in this conference. I really like its title, Holistic Approaches to Pandemic Risk and Response. And I'm delighted that biomedical and social scientists, including economists, are working together along with people from governments and businesses in looking at this important issue. I shall focus on the whole of society approach to pandemic readiness and response, basing my remarks on experiences since 2005, when I've been working as the United Nations coordinator on avian and pandemic influenza. I'll offer you my thoughts on how you can best contribute to, unite with, and encourage learning from the global efforts. And what I'm going to offer you is 5 observations and 5 priorities. So here's my first observation. Whenever attempts are made to control outbreaks and pandemics caused by a specific pathogen, try to focus primarily on the people and communities that are affected by the pathogen, rather than just on the evolution of the pathogen itself. And what I mean by that is focus on people and not on the virus or bacterium. This means maintaining a clear focus on people's health and well-being, their anxieties and coping strategies, and ways in which they interact with healthcare professionals and other officials who care for them. And remember that traditional healthcare practices and systems for medical care are extensively used by people who feel that they're at risk as a result of a disease outbreak. These traditional practices are ingrained in all societies, and they're an important part of the healthcare fabric everywhere. In addition, different sectors of government and professional specialisms are involved in disease control whenever there's an outbreak. And the single factor that should bind together traditional and modern systems, as well as different sectors in government, should be their focus on people and their well-being. During the outbreak of severe acute respiratory syndrome, or SARS, and also during outbreaks of H7N9 influenza, many people in China and beyond have used traditional herbal and food-based strategies to prevent illnesses of all kind, especially respiratory symptoms. So the implications of this are focus firstly on the interests of people who see themselves at risk of infection, of disease and of suffering or incapacity. And secondly, focus on ways to empower people so that their risks of ill health are minimized, and do this at all times. My second observation. Professional and sectoral silos are restrictive and may even be dangerous. Concentrate on the linkages between different government departments or disciplines, and at the interfaces between these departments. An understanding of how people and pathogens interact, even before infection actually occurs, is key to implementing meaningful actions that prevent occurrence. In order to prepare individuals and societies to anticipate disease threats and, if necessary, to respond in ways that are ethical, efficient and effective, a multidisciplinary approach is absolutely critical. And identifying and then filling gaps in preparedness calls for an understanding of disease threats from a multidisciplinary perspective. It also calls for long-term work on linkages between different sectoral issues and concentration on the interfaces between them. This approach is being applied in what we now call the One Health approach, with its targeted focus on limiting the health risks at the interfaces between animals and humans in different ecosystems. But working across sectors presents challenges. What are the kinds of systems that help this kind of integrated vision come to life? How best to invest the scarce time of busy professionals so as to make integrated working actually happen in practice? Well, what I've learned is that if you're engaging professionals in interface working, you've got to use their time very well, or else they will walk away and go and do things that are more familiar to them. Use the time that you've got to build and maintain trust between different professional groups. Innovate and learn lessons across the different sectors, and do try to establish functional operating systems for interdisciplinary working. Adequate political support as well as financial resources are needed to make this kind of working happen. And if the necessary political support and funding are not available, then collaboration will almost certainly not happen. And the worst situation is when people think that they're working well together and report that interdisciplinary operations are actually taking place, but in practice they're only talking about it and not doing it. That is very dangerous indeed if you're working on interface-related disease issues. Now here's my third observation. Whole-of-society approaches, guided by quantitative and qualitative epidemiology, seem to be those that work best when helping people prepare for and respond to complex and unpredictable disease threats. Now, what do I mean by whole-of-society approaches? I mean involving everybody. Don't rely on the media as the primary source of information. Don't rely on the health sector as the only group that are actually supporting people in the face of disease. Of course, both the media and the health sector are vital, but helping people to prepare for and avoid disease calls for engagement of all different groups in society, within government and beyond, including, for example, local community organisations like the Red Cross and Red Crescent societies. Now, what I do insist on is that all who are involved in the whole-of-society response are guided by good quality and quantitative epidemiology, backed up by qualitative studies, to help all concerned estimate and understand different determinants of infection and the risk factors that make infection more likely. And this has been really important in work to try to reduce the risks of avian influenza. Epidemiology also provides insights as to the personal practices that can prevent or encourage the spread of diseases. Preparing for unpredictable threats that cross borders and affect the safety of all people can only work if it's based on trust and mutual respect. So bridging gaps in information and differences in approaches between sectors and across countries is urgent. But what is needed is a proper whole-of-society approach. You know, there are some excellent examples that have involved China and other countries in the Mekong region, and I've seen them in practice, supported by professionals who trust each other working across borders. I think it would be useful within the whole of society approach to encourage assessments of the effectiveness of traditional remedies used to control disease outbreaks. And this does call for collaborative efforts between relevant Western and traditional research institutions. Now to my fourth observation. Always try to assess progress and impact by examining changes in the likelihood that people will actually be affected by disease. Now, I want to stress that in this kind of preparatory and response work, progress assessment should be undertaken from the perspective of the people who are most at risk of suffering. Don't simply concentrate on what different government departments or institutions are doing, or what different staff are calling for, or indeed of specific actions within the health sector or other sectors. We should always remember that preventing, controlling and responding to emerging diseases, though it's complex and sometimes sophisticated from our perspective, must be made comprehensible to and meaningful to the people for whom we are working. And that means that whenever we're assessing whether or not we're being effective, we have to understand the contribution of all who are involved in this effort from the perspective of people. Is their risk being reduced? Are they enjoying better health? Are they better able to prepare? Well, let's find out from their perspective. And now to my fifth observation. When it comes to preventing disease and preparing for outbreaks and pandemics, politics and the views of politicians really matter. Prevention is often valued, certainly by government officials, but what really matters is whether or not prevention and preparedness for disease outbreaks is valued by political leaders. And they will tend to question the usefulness of prevention and preparedness, especially if the risk of a disease occurring is unclear. Because, investing money in this kind of what we sometimes call public good is difficult because budgets are always under stress, and often it is the budget for prevention and preparedness that tends to be cut, especially if the risk of a major event is unclear. We've all seen this in disaster preparedness work, and it's the same in preparing for diseases and pandemics. Try to be clear and honest about the risk, and then link that to the preparedness effort, and then advocate for the finances needed, but without excessively making the case by inducing fear in people. Those who advocate for preparedness are not trusted if they seem to be exaggerating their case. And if they're not trusted, maintaining political support and mobilizing funds is especially difficult. Now, I want to say that governments increasingly understand that it is useful to invest in disease prevention as a kind of insurance. And there is a recognition of the need from time to time to spend money on prevention, or even to control people's movements when a high-risk event is suspected. However, governments and health authorities from traditional and formal medicine are not forgiven if, over time, it transpires that the actions that they request have not actually been strictly necessary. In disease prevention and in preparedness, false positives are not popular. And a political and public perception of overreaction can greatly diminish the long-term political emphasis on preparedness, which does lead to lowering of budgets and less effective actions. I want to say that the preventive measures that have been advocated by health organizations in related to influenza viruses in China and surrounding countries that have focused particularly on communities that are most at risk have proved to be very valuable, especially when they've been adopted consistently and in ways that bring together the different branches of medicine. So, based on these observations, I offer you 5 priorities. Firstly, do analyse infectious diseases from social, cultural and political perspectives in order to understand the drivers behind disease emergence and spread, and in order to develop solutions to the threats that are posed by these diseases. Secondly, be guided at all times by the experiences of people, their communities and their nations. Focus on helping them to reinforce their resilience in the face of threats to health. Thirdly, if you are developing solutions to the threats of an infectious disease, please be clear on the purpose of the solution that you're developing. Make sure that it focuses on people, and think unconventionally about how best to achieve your purpose. Be opportunistic. Build on what people are already doing and what is already working. All the time trying to find popular associations or organisations that you can work with, as well as, of course, working through more formal government or other institutions. Fourthly, whenever you're involved in prevention and preparedness, do adopt whole of society and multidisciplinary approaches. Again, ensure that societies are at the centre, that people are the absolute primary focus of your efforts, supporting them through networks of multidisciplinary practitioners. Time, trust, consistency, transparency and openness are all vital characteristics of this work. And now my fifth point. Stimulate energy and innovation when you're involved in disease prevention and preparedness. Bring on board people from communities that are affected, people who are at risk. Engage experts in alternative and complementary medicine. Involve business people and scientists from a range of disciplines. This is what the whole of society approach involves, and in my experience, it tends to be more likely to succeed than focusing through one specific sector or discipline. So now some words of conclusion. You, the experts gathered at this conference, span a diverse range of expertise. You have a big mix of institutional affiliations. You have the capacity to share really extraordinary experiences. You can show how different approaches can be made complementary. You can identify the kind of research that needs to be done and the collaborations to be developed. You can indicate the kinds of institutional models that are necessary to improve learning and to share experiences. And you can make explicit connections between the different medical approaches to health promotion, pandemic planning, and preparedness among the people. In my experience, whole of society, people-centred and inclusive approaches are the way to go. Your meeting is extremely important in advancing this approach, and that's why I hope that your deliberations are productive. They could have enormous implications in the long term. Thank you for the chance to be with you today.
We're very grateful to Dr. Nabarro, and I'm sure you'll agree that we all want to give him a sincere vote of thanks. We shall pass that on to him for his very helpful contribution to our thinking here today.